want to give you a very quick overview of the mental health continuum. We used to think that mental health was static and that if you were born with good mental health, you'd be stable for your entire lifespan. So currently you might be in the upper right quadrant, which means you are experiencing optimal mental health. So this is good. This is where we want to be. But we now know that if you experience a major life event or a stressor, you can actually see a decline in your mental health, which means you may at one point find yourself in the lower right-hand quadrant of the continuum. So this is where you're experiencing the signs of poor mental health. And some of these might include fatigue, irritability, low appetite, and inability to cope with stress. But the good news is, for many people, depending on your coping mechanisms and your resilience, you can return to that optimal mental health by using healthy coping skills and other techniques for stress reduction, and even just by implementing some minor or major lifestyle changes. For some, they may get stuck in the lower left quadrant of the continuum, and they may be diagnosed with a mental health problem, but there is still good news around that. With lifestyle change, coping skills that are strengthened, and a strong support system, you can recover back to that optimal mental health. So this means even though someone might be diagnosed with a mental health problem, they can still be considered to have optimal mental health. So when we talk about stress, we need to distinguish between the two types of stress. There's acute stress and chronic stress. You may experience acute stress when facing a deadline or if you're working on a project. However, once that deadline has passed or the project is complete, you return to that normal state of low stress. Chronic stress, however, is when you experience daily, relentless, high stress that over time, it can seriously impact your physical or your mental health. When the body is living in a constant state of chronic stress, it releases high levels of cortisol. These high levels of cortisol might impact the brain's ability to absorb the chemicals in the brain that support healthy moods, such as serotonin and dopamine. Stress reduces the brain's innate ability to keep itself healthy. As a result, the hippocampus, a vital part of the brain, actually shrinks, impacting negatively on both our short-term memory function and our learning abilities. 1 in 3 Canadians will experience a mental illness in their lifetime. 1 in 3. So that's you, that's me, that's our loved one, that's our neighbor. Anyone can experience a mental health problem at any time, depending on the stress level and their ability to be resilient.